Dr. Bharat Pankhania has been with us throughout this crisis so far, Senior Clinical Lecturer in Public Health Medicine at Exeter Medical School. Doctor, what do you make of these measures?
Thank you, Eddie. These are the sort of things we have been discussing over several weeks on your program, and I'm very pleased to see that most of the things that we discussed and expressed concerns over are being implemented. I tend to work on the line of now rather than tomorrow. So even waiting this weekend is a couple of days too much. So if you can start isolating yourselves now, then now is a good time. One more thing I really am very anxious about is that the United Kingdom is not testing in the community. And when we are not testing in the community, we don't have a precise picture of what's going on in the community. So compared to other countries, we are way down in terms of community testing.
So your advice on vulnerable people and older people is don't wait for the weekend. You should shield yourself from social contact right now.
Immediately, yes, indeed. I mean, what difference is 2 days, 3 days going to make? The thing is, I don't want anyone to get infected. And if you can shield yourself today now, please do so.
It's a big ask, isn't it? I mean, we understand the thinking behind it and the need to protect ourselves. But to say to goodness knows how many people, lock yourself away for 12 weeks right away, despite all the warnings. And you're right, you've spoken about this over the weeks. It's a shock to the system.
It is a shock, but this is where I feel communication is very good and important. So we have been talking about it, and we have been highlighting that this is the best thing to do. Do it. Get yourself ready. Get yourself informed. So therefore, what you and I are talking about today is not new. It's not a shock because we've been talking about it for several weeks. And therefore, now is the time to say, look, if you can, there is no panic, but if you can, as soon as possible, remove yourself from circulation. It's good advice.
And this is people over 70 and people with serious underlying health conditions.
That is correct, and that is the government's line. I am a little bit more generous with my line, and as you will know, I have been saying 60 plus, because the data indicates quite clearly that as soon as you hit 60 plus, you can start to get more severe illness. I appreciate the 70-year-olds, the 75-year-olds, the 80-year-olds have more severe illness, but the graph starts to creep up at 60. So hence my assertion of 60 and beyond.
It's always good to hear from you. Thank you, Dr. Bharat Pankhania, who I hope will join us again to be taking calls in the not too distant future.